joined in the studio now by Dr. Nick Hatt. And we've had lots of health questions, so we're going to kick them straight off. And straight off, we got, is it Louis? Louis
It's
on
Lois.
there.
Morning.
Lois. Hello, Lois.
Good morning, Lois.
Hi.
Good morning, Lois.
Hiya.
You've got an issue with migraines, haven't you?
Yeah, I've been having them for the past year. I've had an eye test, my eyes are fine. They usually come on in the evenings or in the middle of the night, and then they last for a few days. And I've been to my doctors, and they just don't really seem to be helping.
Oh, they're the worst migraines. I hate them.
So, Lois,
Yeah.
you've had them for about a year. How often are they happening? The frequency of it is really important.
I can get about 3 a week.
So 3 a week. So that's the intent, and they're very intense as well.
Yeah, I get like the pains in my head and the funny vision.
And are you taking any medication like triptans or sumitriptan, anything like that at all?
They gave me some tryptin, but you only get 6 in a box, and I'm using like a box a week.
Okay. So it's really important to understand headaches as well. I would say that if you're getting 3 to 5 headaches a week, then that's known as a recurrent headache. And the frequency of that is quite a lot for what I would say is just a normal migraines. Migraines can be headaches that are generally all over. They can be with an aura or without an aura. So if it's an aura, it's when you get the flashing lights and the tingling, and you can have some symptoms like numbness on the face, and that's classical migraines. But if you're getting sort of, say, 2 or 3 a month, then I'll say, do you know what, that's all right, that's okay. But if you're getting them as frequently as that, and the sumitriptan, so triptans are a group of medicines that we use to treat headaches, and if it's not working, I think it'd be well worth going back to the doctor. I would like you to keep a symptom diary, Lois, so find out what's making it worse, what's making it better. If you've had fluids that day, stress and anxiety, if that impacts on your headache, but this would be one that would be worth going back for a consultation again.
Okay, thank you.
Yeah, get back to your doctor, darling.
Good luck, Lewis. Best of luck. Speak to Sandra in Cornwall now. Sandra, you have a problem with your poor husband who's got constant pain, is that right?
Yes, he was diagnosed with diverticular and IBS about 9 years ago. He is, he's under the doctor. He does take medication, but the pain he gets is absolutely so severe. It's not always severe, but it is definitely there all the time. He's never without it.
I'm so sorry, Sandra. So IBS and diverticular disease causes a bit of confusion to people, because diverticular disease actually is really common. So what diverticular disease is when you get stiffening of the bowels, and that comes with constipation, and you get a weakness in the bowel wall. Where you get weakness, you get these little pouches that form. And if poo gets stuck within those pouches, it can cause an infection and severe pain. The statistics are really surprising. A lot of people suffer with it and don't realise it. So 1 in 20 at age 40 will have diverticular disease. About 1/3 to a half will have it at 60, and about 2/3 will have it at the age of 80. Yeah, so it's a disease of age. And that's why what we need to do is look at how we can manage that. Now, with Sandra's husband, he's getting pain a lot, and I wonder whether he's on pain medication like codeine, or sometimes that Oromorph is used because the pain is that much.
Is that morphine?
That is a form of morphine, it's the oral form. But we need to understand that these medications cause constipation, and constipation then makes your diverticular worse. So if you are on codeine-based medication, please take a laxative. But if it is as intense as it is, especially with Sandra's husband, and he's got irritable bowel, which is probably impacting him on worse, then it'd be worth going back to the surgeons to see if there could be a surgical option for this. I'm not saying that that's what he needs, but diverticular disease is unfortunately a chronic condition, and it is debilitating, it's horrible, and pain medication can sometimes make it worse. So making sure the balance between constipation and having loose motions, and making sure that the diet is okay, making sure you're having enough of fluids, that is going to be really important. So there's a FODMAP diet, which can be brilliant to follow. So that's a specific diet that just helps with irritable bowel syndrome as well.
What's it called?
FODMAP diet. So you can Google it, and it's really easy to find.
Okay.
Sandra, I hope that helps.
Yes, that is much better. That's better for me. He is on Progabalin. The doctor increased it from 25 to 50, and he also takes Buscopan, but it just doesn't seem to, work because, as I say, he is in the constant pain.
But with his Pregabalin, is he taking laxatives as well, Sandra?
He takes Laxido.
Laxido. So look at the doses of that, and sometimes you might need to give another laxative as well. And even if it's not, because you could be going, but actually what you're getting is overflow constipation. So taking something like glycerin suppositories. But this is why I think it's important that you keep a symptom diary and keep going back to your doctor if you've done the optimum amount of treatment that your GP has given you.
Okay.
All right.
Thank you, Sandra.
Thanks, Sandra.
OK, let's go to Surrey now. Cherry's on the line. Morning, Cherry.
Hello.
Hello. You know, you're getting... Is it you that's getting these heel spurs?
It is. It's really, really awful pain anytime you put any pressure on my foot. I've had it for a year now, and I've tried taping, I've tried gel insoles. I'm just wondering if there's anything else I can be trying.
What is a heel spur?
Heel spurs are just a nightmare. So it's essentially you get an inflammation at the base of the heel, and you have this band of thick collagen that runs at the bottom of the foot, so between the toes right to the heel, called the plantar fascia. Now, that plantar fascia is actually the thing that becomes inflamed and swollen, and it can happen for lots of different reasons. You guys have got laminate flooring, so if you walk around barefoot on laminate flooring...
This is vintage.
OK, it's vintage.
An old department store. What do you mean laminate?
Sorry. Oh, sorry. But if you walk around barefoot all the time, or you have increased in your weight, for example, then that fascia can become inflamed and can be really sore. Classical symptom is that at night time you end up getting pain in the base of your foot, and when you wake up in the morning, you put your feet out the bed and that pain hits you. It's rotten.
So what can she do?
So doing the exercises, it's going to be, you're not going to like me for this very much, I'm so sorry. There's no quick fix. It's going to be a management pain. So using deep heat gels, making sure that you use non-steroidal anti-inflammatories. So something like diclofenac and naproxen, if it's okay for your stomach lining and you don't suffer from asthma, so there's no contraindications. Paracetamol. In severe cases, you can actually then be referred to a surgeon, a foot surgeon, like an orthopaedic consultant, who might want to put some corticosteroid injections in there. But that's not recommended for everybody. So.
Okay. Best of luck, Cherry.
Best of luck with that.
Rotten. Nighat, thank you so
Thank
much.
you.
Thank you so much.
I could talk all day, I'm so sorry.
You're brilliant.
Listen to you all day, Nighat. That's
I know.
great.
Thank you so much.
Thank you. It's great to have you with us. All right, local weather forecast.